Hello everyone, I'm Meena Norona and I welcome you to another episode of Walk the Special Path. Today we have a very distinguished guest with us who is going to enlighten us more in the special need awareness talks. Welcome Dr. Rameela Shekhar to our talk show today.
Thank you.
Dr. Rameela Shekhar is a very known figure in Mangalore and all over India. She has done her studies at NIMHANS, Bangalore and served as a professor, HOD and Dean, PG Department of Roshan Nilaya for nearly 34 years. Currently, she is the Director and Practicing Child, Adolescent and Youth Mental Health Professional at Manashanthi Counseling, Training and Research Center, Mangalore, which she herself initiated. She has conducted more than 1,000 programs for students, teachers, parents and members of various government and corporate sectors on family life, relationship, mental health, etc. She was conferred the Best Educationist Award by the Global Society for Health and Education Growth, New Delhi in the year 2015. She is also the author of books on child mental health and women mental health, a manual for teachers and parents on child mental health. She is a member of many local, national, international organizations. She is appointed second time as Juvenile Justice Board member for Dakshin Kannada. She is also a member of Mental Health Authority for Karnataka. Her special interest of working with children, adolescent, women and family related areas and conductive, preventive and promotive programs for children, adolescent and families. Such an accomplished person she is and we are so happy to have her with us on this talk show. Once again, welcome Dr. Rameela Shekhar to our program today. And I hope many of the parents out there, special needs parents who are struggling with the special need young ones would be benefited from her words. So ma'am, I would like to ask you first thing, like today's program is how to manage behavioral problems in special needs children. I would like to ask you what are some common behavioral problems faced by individuals with disabilities?
Okay, thank you Meena. Now, first of all, I think we need to understand when we are talking about special needs children, the behaviors that are seen in them. I'm not going to classify it only as problems, but I'm going to show it as behaviors that are seen in them which might not be appropriate at that particular time. So now, if I want to divide it, the behavior problems into two types, I would want to divide it into something that they do to themselves and another what they externalize to others.
Okay.
Now, when talking about those behavior issues, I'm talking about that they show by themselves, the first thing would be when these children are not able to cope with situations. The one way of communicating this distress is that they do sometimes self-harm. Like for example, it could be banging the head to the wall, or even sometimes we have come across some children say when they are very, very angry, they pain themselves, they pinch themselves, they hurt themselves.
Yes.
So now this is something that I have seen very, very often. Another thing could be throwing tantrums. Because again, this is when they are not able to communicate, they don't know how to tell them, they throw tantrums like throwing things, rolling on the ground, hitting people around, which the persons around them are not able to manage.
I think many parents and teachers tell about this, the child is not behaving.
Absolutely.
I think that's what you're
Yes. And just the opposite of what I've just told you is, another behavioral issue that we see is children not being able to build communication, build interpersonal relationship and mix with or socialize with other children. So this comes across very often in school settings. These children are not able to mingle with others, they are not able to play with others, they isolate themselves. Now this is one part of it. Now the second part of it is what we see as problems actually. One of them would be oppositional defiant disorder or problem as we call it, where they show behavior that is defying whatever is being told. They show behavior that is just opposite of what is being told. They are very resentful. They are very arguing. There is a lot of blaming that they do to others, and the behavior becomes very difficult for parents to manage. And sometimes we also see another behavior problem that is very typical in these children is that they indulge in activities that are not appropriate or not accepted by the social norms. Like for example, there could be a lot of lying. There could be taking of things. Okay, they could be indulging in activities that are not appropriate to that age. Now, a simple example I can give you is here. We had a particular child who was brought or sent by the school saying that the child was found taking things from other children's bags. Okay, so they named it or labeled it as stealing.
Right.
Okay, the moment I was able to see the child, I realized that there was something that is, not that the child is doing it on purpose or wants the things. Okay, so we just started building a rapport with the child. We started talking to the child, and then I realized that the child's intelligence is below the normal range. And the child is not able to comprehend the fact that what is the consequences of him taking. And another thing that we saw very typical was that this child was being told or instigated by other children to do these things. Okay, and it's a sort
they get
of a
easily
bullying.
influenced.
Yes, very, very suggestible.
Bullying also is very common nowadays.
Very suggestible, very vulnerable to these, because they are not able to actually understand the consequences, that if I take this will happen.
And they want to fit in with the others, so they listen.
Because they want to be in that group of other
part
children.
Of that, right.
So that is something that we are seeing very, very often.
But ma'am, these are there in special needs, learning disabled children also, all these?
Yes, they are there also in learning disabled children, because especially now that you have spoken about learning disabled children, these children do not get that acceptance in school because of their learning issues.
Yes.
So how do they get the acceptance? By being a member of another large group. If otherwise, these children are not accepted by the other children, because everybody wants to be in a group where the children are good in studies.
True. And so, according to their normal norms, they should
So
fit
now
in.
This is one way that the child is allowed to be in a group. So that's also we had another child. Now that you have spoken about learning disability, we had this one particular child who used to take money from this house. From a home.
From home.
Yes.
Okay.
And this we realized as we started talking to him, that this was because of the other children were instigating, and he was buying things for other children.
Okay.
He would buy samosas, he would buy all these things for other children, because then he was openly saying, otherwise they don't include me.
They don't accept me, because of the problem.
So these are generally some of the problems that we have seen in these special children. Okay. But another, going back to the first part, I've seen a lot of self-harm and isolation that is generally not, recognized itself by anybody. So when they are isolated, you just take it for granted that they are quiet.
Okay.
You don't understand that this is an issue and it needs to be addressed.
Okay. They become emotionally, I think, isolated.
Absolutely.
I think that is one of the main reasons, especially parents worry if their child is little, lacking in certain areas. They feel scared to send them to centers where it is integrated learning, because they are scared of that. So ma'am, now you told about these problems. Can these problems be prevented, ma'am? If so, what can be done, or how can we do it?
Yes, definitely it can be prevented. Why I am saying prevented is, I think most of the time the problems come to that particular degree because the behaviors are not recognized. I think my first point that I would like to give is the parents have to accept this particular psychological issue in the children, that they are either children who have a low IQ, they are either children with some disability, or they are children with a learning disability.
Right.
So if you are able to first accept that,
Right.
I think half the battle is won.
Right.
Then secondly, there is a lot of negative attitude that, you know, engulfs these children.
True, ma'am.
Because especially now with the academic, the positions that
There's
are
a lot of
given a lot
competition
of
going on.
importance to, every parent wants every child to do the best, which becomes very difficult. So what happens is the negative attitude is what brings about these, behaviors in the children. So if parents can accept the fact, because why I'm saying this is, when a diagnosis is made, either after a psychological assessment, and when I give the diagnosis to the parents, I see a lot of resistance.
They are not ready to accept
No,
it.
they are not ready. And I know that at least in my 40% of where I have given diagnosis, I know that the parents will not come back to me.
Right, that's happening.
They don't come back to me. They prefer to go somewhere else with the hope saying that somebody will tell them that the diagnosis is wrong. And that only what happens is delays the whole process for me. Okay.
Really,
So I
yes.
think that is something that is very important. That negative attitude being turned to a positive attitude. Okay, where I look at saying that, can the parents look at the strengths of the child? Because every child with a disability also has a strength. So that is one way of preventing. The moment parents look at the strength of the child, okay, the child reacts totally differently to the whole issue.
I think the child needs that support.
Absolutely, absolutely. And another way of, preventing is not underestimating the capacity of the child.
True, that thing, yes, that's correct.
I know that I have a learning disability in mathematics, but I also know that I'm very good at drawing.
Okay.
If my parent would recognize this particular fact that I am good at drawing, divert me into that drawing, I think again that would make me feel very nice.
We work
and
on the
that would-
strengths.
Absolutely. I think I'm not looking at preventable in the sense anything in a large scale. It is just what can be done at home, basically by the parents, and also I think maybe you'll ask later on what can be done at school. These two factors can definitely prevent a lot of these behavior problems in these children.
Now you are talking about the parents, ma'am. When behavioral management, sometimes they behave at home different, in school different. So what is the role of the parents exactly in managing such behaviors?
Okay, I think there's a lot of things that has to be done. Again, I'm going back to the same thing. I would put it in simply 5 points maybe. One is love the child unconditionally.
I think that's very, very important.
Yes, I think that's the main role, I know as parents, all of us have a lot of expectations, a lot of desires, a lot of aspiration. But now this child is mine. If I can love him as he is, with this problem, with his strength, that is one thing. Second, I don't make any distinction when I discipline this child.
Okay.
This child with a disability or a special need also needs to be disciplined just like any other child.
Okay.
Why am I saying this? This will be a guiding path.
True.
So again, going back to the last question that you asked, proper disciplining can prevent the problems from occurring. Okay. Third, I gave you this. What are the problems? Now, when I spoke about the problems, I told you why these problems happen. Mainly it is because there is lack of communication. These children are not communicated with. Even parents don't communicate, even teachers don't communicate. If they are staying in an apartment, for example, there is nobody else that is communicating with these children. So I think the third important role of the parents is to be able to set aside some time and be able to communicate to these children so that these children are able to ventilate their inner feelings. For example, a child is isolated in class. The child also wanted, now I came across this very recently when the school day was going on. Okay, generally children who are chosen are the
Very intelligent ones or the
very
smarter
good ones, the cream of the class.
That's always,
now
yes.
this child wanted to be in the choir. Okay, she went and told the teacher, but the teacher just brushed it off by saying, I don't think it was done purposefully also,
They have
because
the
I know
pressure
that
of
thing,
choosing the
or
best.
they also are so engrossed in this program.
Right.
So she just brushed it off saying, I'll see you later. But when actually the practice started, this child was not called.
Okay.
Okay, she had it in her mind, and she came back and told about this to her mother. And unfortunately for this child, what happened is the mother also brushed it off, saying that anyway, what is the big point?
It's very sad, yes.
Okay,
I think it's
nothing
not
is
very
going
important,
nothing
right.
important. This child went into almost a depressive attack.
Oh, very sad.
Very, very, very sad. See, this is if the mother would only communicate, I know what you're feeling.
Right.
And she would give an explanation saying that it's okay, we'll put you somewhere else. Then I think the thing would have been better. So that's the third part. Fourth, very important for me as parents is, how do children learn? What is the behavior that they show? It is by modeling us.
Imitation, yeah, correct.
Yeah, by emulating or modeling us. So I think if you want the child to behave in a particular manner, okay,
Right.
you show that behavior to the child.
Right.
So for example, if you want the child, not to be very negative, okay, not to show anger,
Right.
okay, not to self-harm, I think you too should not do that.
True.
So I think that modeling is something that is there, and I would put the whole of this under one big umbrella is, I think the biggest role for parents, which is becoming very, very difficult in nowadays time, is give time and listen to the child. I think
that's very important.
That's a crux
That's even
for
I
me.
think for normal children also.
Absolutely,
That is, and
for
special
everyone,
children,
but
it's
for
more.
these children they need more.
It's more.
You really need to keep aside some time specifically for these children.
Nowadays parents are so busy, so very busy,
Absolutely,
working,
absolutely.
running. They don't have time.
Absolutely. And I don't think we can ever use the word to any children, but to these child specially saying, I don't have time.
Right. That's very true, I think.
I think these things is the main role for any child, as you said, but I would give a lot of emphasis for these special
Yes.
children.
I think parents out there who are struggling with such children, please see that you give more and more time. Yes, there's a race, nowadays it's a race competition, I think. But we need to take time out, like we say, we need to take time to smell the roses. We need to take time out to be with our children, to understand what is going on. And ma'am has told us such wonderful things. I think we should put it in practice. Maybe it will bring a vast change into your lives, in your children's life.
Yeah, absolutely. Yes.
So ma'am, I would like to ask you now, you told us about these behavioral problems. So what are behavioral management strategies that can be used, maybe in school or at home?
Yes, I would put it as both the places,
Okay.
because I think parents and teachers have to be conscious. I wouldn't call it as huge strategies. It is some of the small things that you can do.
Small steps, like how
that
we
you can take
yes.
to see that these children are helped. Now, the first thing I would say is, I think one thing that we have got to understand is, any behavior that is learned can be unlearned.
Okay.
If you have that in mind, all these problems that I've spoken about are learned behavior.
And here I would like to ask, is there a particular age where they can unlearn these things, or any time?
Any age. Sometimes we even have adults being able to unlearn something that they have learnt in childhood. Only thing is that openness should be there, that I can unlearn it. So I think with that principle in mind, some of the strategies are: one, parents should be able to make a list of the target change behavior. What is that I want to change in this child? And be very specific when you are telling this to the child. Generally what I see in these parents is, I can understand there's a lot of burden in them. Okay, they find it too heavy. Okay, so as I just said, they lose their tolerance, their calmness. So there is usually umbrella statements that are given. Why can't you be like other children? How does this child know what is it that is other children?
Right, that's correct.
So I think what I would want you to do is sit down with the child, list the behaviors that you want the child to change. Like for example, maybe, like, see, I've seen you that when you get angry, you bang your head to the wall. Now, this is one behavior that I think that we can change. So, or even for example, as you mentioned, I would want you to sit and spend this much time for your academics. If you're telling a child with a learning difficulty, special remedial classes, this is something that I want. So, list these behaviors.
Okay.
Spell out these behaviors that you want to change one by one, and try managing it one by one and not all in a shot.
I think we have to break down into small steps and work at
yes,
their level.
That is another part. That is what I'm talking about, is another part. What you're calling is chaining, that we call. Okay, that is also there. Like for example, even when you're talking about this, you break it down. Like simple example is maybe this particular child whose IQ is a little low, you want the child to be self-reliant. Okay, now what is one of the things that you would want to do? He has his food, you want him to take and wash his own plates.
Okay.
Now I can't tell this child, just like how I would tell everybody, go take your plate and wash. No. What I have to do is break that, as you said, into different steps. The first will be, take the plate and keep it at the sink.
Okay.
Let him do it for about 1 week.
Okay.
If he does that and he gets used to that, then you do the second step. That is, let the water and wet the plate.
Okay.
Third is, wash it. So that way, step by step by step, if I
Need
go.
a lot of patience with these
Absolutely,
children, work
absolutely,
slowly.
absolutely. So, but I think I'm dealing with my child, no?
Right.
So I have one child. I can't explain. What most of the time we see is, we see these expectations that parents have on the teachers, but the teachers are dealing with 50 children there.
Right.
Now, if I can't do that with one child, then how do I expect the teacher? So I think this is one thing. Be specific. Like even for example, I've heard a lot of people say, be a good boy. What is good?
They don't understand.
That is something. Say, I would like you to talk like this. Or I wouldn't like you, when a guest comes, I wouldn't want you to do this particular behavior. Maybe a child has that repetitive behavior sometimes. Maybe in some children they have a repetitive behavior, or they have some sounds that they produce.
Or they keep on questioning or talking or something.
Sounds that they produce, or whatever it is. Pinpoint that, rather saying, why can't you be a good boy? I don't understand what is a good boy. So
Right.
I think that is one thing. And most important, when you're changing or modifying this behavior, don't label the child.
Right. True.
You're a dull child, you're a bad child.
Nothing
you're
negative.
useless.
We
Yes.
try to be a person.
Yes, that's one thing. And in case there are some negative behaviors, one of the strategies that I have used in the clinical practice, and I think parents can use it in the normal day-to-day life, is, as far as possible, ignore the negative behavior, recognize the positive behavior.
Okay.
Like for example, the child is hyperactive. Child doesn't sit in a place. You have given a child a task and you have made him sit in a place. So what you do is, when the child sits for 5 minutes, recognize it. When the child does not sit, for once, just ignore it. So then the child, see, many a times, why do these children do it? Because they want that attention.
Attention, yes, attention seeking, yeah.
So then when the child gets this attention for doing something, then the child starts slowly bringing that up for
They
me.
think, okay, if we do that, we'll get more attention, so they do more
Absolutely,
first.
absolutely. And maybe just, I know that is, so one more thing, that strategy that has been useful for me is time out from positive reinforcement. It's very important strategy for all these
What is
special
that, ma'am,
children.
exactly?
Yes, time out. See, there are some positive reinforcements that we give the child. If the child does something good, we allow them to see the TV for 45 minutes.
Okay.
If the child is good, we take them out for a Sunday.
Reward sort of thing.
As rewards, that is. Now, when the child does not show the positive behavior, take this out.
Okay.
Take this out, saying that, and be very specific. Okay, you have to explain to the child. say I had asked you to do this, you didn't do this, so now your 45 minutes of TV is going to be cut. I'm not going to say anything bad to you.
Okay.
Only thing is, I know it is your free time, you'll simply sit there.
Okay.
You won't get TV.
Okay.
Or you won't, this Sunday, you won't come out with us. It's very, very, very difficult to work it out, because many a times parents go out only for the sake of the child.
Right.
I know it.
But they have to be firm.
But if you do that, the child will learn, okay, this is something that I have to do. What we do, what the parents, I see the parents do is, they tell, okay, you're not going to, I won't take you out. But then when Sunday comes, there's a small adjustment. I'll take you out only this Sunday.
Right, it happens here. Most parents get easily swayed.
Yeah. And as you said, I think the last thing maybe I would want to tell you is, we could use the star chart method, which I use at the clinical setup also.
Okay, it's a reward.
That reward setup. Give them tasks, give them charts, give them the stars, or if they are small children, I use this smileys. Okay, you have a smiling smiley, you have a crying smiley. So I give them those different, and I tell them as soon as they do a task to put a smiley, nice smiley. If they don't do a task, either to put a cross, or I give them a sad smiley and I tell them to put. And at the end of the week, we count the number of positive smileys that they have. So that gives them also a joy. See, every day morning, they are supposed to look at the smiley and feel nice. So, and there's evening before they sleep, they're supposed to put the smileys. So that becomes a very joyful thing, and I have seen the joy in these children when they bring that chart to me, and they have got so many smileys.
Yes, really
I think
nice.
it's something that
And here I just like you have explained all these things. It's okay for children who are able to express. There are some children who are not able to speak verbally, or they are non-expressive, they don't know. In such, when they have these behaviors, how a parent can adjust with that, or
see, this is, maybe they are not able to speak, but they are able to comprehend. They
what
can
level
understand.
we don't understand?
But thing is, it depends a lot on how you are able to tell it to them.
Communicate.
You should go down to their level and communicate. See, this is something that we have done. I have worked out star chart methods with children with intellectual issues, with children with hard of hearing, children who have autistic features, everybody, and it has worked because this is something that they can see. And the moment you put a smiley itself, you can see a change in their facial expression.
Because parents nowadays, they get so emotionally exhausted, physically anyway they get when they have special needs. So emotionally and mentally exhausted, they don't have that patience.
Absolutely.
So I think they need to bring about a change and work.
Yes, absolutely. I think that is something that is very, very important. I think, don't lose your cool and don't lose your hope.
Parents mostly, which I've come across, they get so, at the end of the day, they are fully exhausted, especially it's mental exhaustion, because they don't know how to control, especially if the child is hyper, how to go to that level. So I think they need to bring about a change.
Yeah, and maybe when you're talking about that, I would also say, along with the children, I think it's very important for the parent management training to go on also. What we call as PMT, it's very important because parents also need a chance to ventilate.
Right.
Parents also need some guidance. So along with the training for the children, training for parents has to go hand in hand.
I think there I would just say, ma'am, we started a support group for parents with special needs.
Absolutely.
Do you think that would be very helpful?
That's very helpful. What you can do is, one is these support groups is a very good place where they can exchange ideas.
Right.
So one parent would tell the other parent, and that it becomes more easy for parents to accept rather than getting it from a professional. But at the same time, in these support groups, if you could have a professional come and talk for 10 minutes, not more. Let it not be a huge lecture. 10 minutes, some tips. I think these things will help a lot.
Okay. Thank you, ma'am. Thank you for enlightening us on this. So hopefully parents, please do these things which ma'am has told us. Really, it will bring a change in your lives. So now, ma'am, I would like, now we are sending the children to school. We find some, their behaviors are different at home and different in school. So how can behavior be managed in a classroom setting for these special needs children or learning disabled children, those are non-verbal? So how can we manage it in a classroom?
Yeah, see, that's what I told you. We have, at home, we have one child or two children. In the class, they have many children. So I know it's difficult, but I think one of the things that they have to do is the classroom teachers have to be very conscious of one thing, that is individual instructional needs of the child. That is tailoring each of your interactions to that particular child is very important, especially when there is a child with a special need in the
I think the teacher should be trained
Absolutely,
particularly.
absolutely. I think this is something that is very, the other techniques are the same, but you have to tailor make it to that particular child, which is very, each one is different. That is one. Second thing, I always tell the teachers when I come across them or when I get in touch with them, when I am sending a child, I involve the teachers a lot. See, when we do the remedial or we do any sort of therapy, I usually contact the teachers and I tell them this is what I am doing, because I think the teacher has a right to know also. This is what I am doing. And one thing that I tell them is, don't give an endless not to do task to the children.
Yes, yes.
See, that I think bogs the child down, and that makes the child, become very distant.
Too many things
too
are,
many
yes.
don'ts. Too many don'ts. Instead of that, keep it very simple, saying that, like for example, again, the same thing matters here. The child who doesn't sit in a place, very restless, for 10 minutes was able to sit. I think it's very important for the teacher to say, like if the child's name is Santosh or whatever it is, saying, Santosh, for 10 minutes you sat, thank you, it was very nice.
Okay.
So
Keep on complimenting.
immediately the child catches it, he'll sit for 10 more minutes. And that's the way that you can
Increase.
Okay. Yeah. And third thing, apart from the other techniques, is establish clear-cut rules and routines in the class. Let it be predictive to the child. It's not like any other children who can change suddenly.
Okay.
So I think rules and regulations, you can do this, you can't do this. Very clearly the child should know. And today, at the beginning of the class, maybe the teacher should say, today we'll be doing this, 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 this. Okay, even if it's studies. Today I will take up a subject of Karnataka. We'll be talking about Karnataka state, maybe the social studies teacher. And in Karnataka state, we'll be talking about the physical, area and this. So then the child is able to understand.
To prepare the child.
I think these are things that is very important.
But these teachers are equipped to do these, ma'am, because nowadays I don't know how many teachers are trained to work with special needs children.
Actually, all this comes in the teacher training program.
In the special education.
Yes, it does come. But the special education teachers are different. They are trained separately. But this comes.
Okay.
See, all the children are not children with special needs, but you should know to relate to the special needs children. That's all.
If you have a SEN department, I think the teachers will be well versed with how to handle.
See, another thing is, we also conduct programs for the teachers.
Okay.
We are continuously conducting programs, maybe through the, the Catholic board. We have conducted for all the teachers in Mangalore and Udupi. I know all the mental health professionals in Bangalore are called upon.
Okay.
So I think that only thing is, I think the teachers, I know it is difficult for the teachers also now.
Right, so many
The
students,
teaching
it's
job
difficult
at
manage.
present is not an easy job, because it's no more only teaching. It includes so many other tasks. So the teachers are also burdened. But I think one small expectation that I have from the teachers is, be willing to help a special child.
That's
if you
really
have that, point in your head.
I think that comes from within, that empathizing or kindness.
Absolutely. And I think teachers have that.
And I think that makes a more wonderful,
Yeah.
a teacher
so
more
if
wonderful.
you're willing to accept this child, if you're willing to help this child, go a little extra step outside my boundary.
True.
The moment I think it is my teaching, then it goes out. This is little extra step. I think it's
That's very beautifully said, ma'am. I think little one step extra makes a big difference in the child's life.
correct.
So even the teacher may not know, what he's bringing about a change. So now I would like to ask you, ma'am, you have been working with so many special needs children, teachers, parents. So what is the take home message would you like to give parents or families, struggling with special needs children or behavioral issues of children? What advice would you give them, or any message would you give them?
Yeah, I've already told. Those 5 points are the
Right.
messages that I wanted to give. But I think one simple thing is, I know as parents, we all have our desires, we all have our expectations. Sometimes these expectations are met, sometimes they are not met. I think the one thing is accept whatever is there. The moment the acceptance is there, as I told you,
Right.
half the battle is won. The more you resist, the more you go shopping around for, different
Cures, I
different
think that's what they say,
Yes,
cures or
yes.
answers to
that, the problem becomes more. So I think accept it, and if the child is exposed to these trainings at a much earlier age, that early intervention, you can definitely see the child improving. And when the child is improving, do not compare it to other
I
children.
think the first thing what parents need is to accept the child as he or she is.
Yes.
Which is very difficult because parents think oh, there is a cure, I do 6 months therapy, it will be cured. They have this
No,
mentality.
yeah,
Accept
yeah,
your child as it is,
child.
like you had mentioned earlier.
Yeah, and don't compare it, because I think
That
that
is
is
the
something
biggest
that is
disease
there
now.
in all of us, because we are not concentrating on our children, we are looking at how good is my brother's child able to
Right,
do
true.
in the family, in the neighborhood, and the moment that happens, I always see my child as very small.
And even I think the parents also get very depressed when you start comparing.
Absolutely.
Every child is unique in their own way.
Yes.
So
And look at the small, developments in the child, feel happy about it. And I think again my important message is, you should spend time with all children, but you should spend more time with these children.
Right.
If you're able to give time, most of these children are able to do quite well. And we have seen examples.
Right.
When parents and teachers have been able to give time, have been able to give that individual attention, these children have reached a level which sometimes a normal child has not reached. They have reached a national level in sports, in dramatics, in so many things. I think that's something that is.
yes, walking one extra step
Absolutely.
ahead is always needed with these children. Yes, thank you, ma'am, so much for those beautiful messages. So again, I would like to ask you, ma'am, now you are living in Mangalore since so many years. Now they say Mangalore is a smart city, but when it comes to learning disabilities or special needs, we don't see, like, there are no disabled toilets or the roads or anyway, parks and all. So I would like to ask you, how inclusive is Mangalore and our society, like, as such? How do you find?
Yeah. I've been working in this field for more than 25 years. From what it was then to now, definitely there is a change, positive change. Especially I'm talking about children. Okay, I'm talking about children. Earlier, I was faced with this great difficulty that these children did not have a place to go. But now, there are schools which are accepting them. That is one plus point for me. Okay, and there are people who are now taking help. Now earlier the referrals were always from schools. When the children are not doing well, they were referred to the mental health professionals, whether it's a psychiatrist and all that. And so I think that is not happening now. The parents themselves are recognizing these problems and they're coming to the mental health professional. That is one thing.
Seeking help.
And I think one plus point of Mangalore that I'm seeing is, we have a lot of mental health professionals, psychiatrists and all, who are very psychosocial oriented. So a lot of work is being done in the preventive aspect, in the promotive aspect. So this input, it's bearing its fruits in the society. That is there. But I do have certain blocks, like just talking about inclusive. Now we know that these children have to go to normal schools. Okay. Now what happens in the normal school? Okay. Now for example, the policies itself has to be changed.
From
Because
the root.
a biggest problem that I face is, I have a lot of children where my clinical psychologist does the test and we are able to tell them that this child has, low IQ. And when this child goes with this particular report to the school, the exemptions are not given.
Oh, sad.
Means not all exemption. See, exemptions are given, if I am not mistaken, to children with normal IQ, okay, the normal range of IQ,
Okay.
Average IQ.
Okay.
Having SLD, they have exemption of languages, or they have exemption of some other. But these children who are also having the borderline and just a
Lower.
little low IQ also need that, because they can't manage, but the policy doesn't give them.
Our policies are fixed.
That's the thing. So I think this needs a lot of work that has to be done.
Okay.
And I know that we all face it, because I am closely working with all the psychiatrists. We speak to the government Wenlock hospital psychiatrists and all that, but this is a policy. So they will give, I send all these children to the Wenlock hospital, they go, they get that certificate, but finally what is the exemption depends upon the department.
I think that's fixed. They can't work between
Absolutely. So that is something. But I would also like to tell you here, the department is also making an effort. I've had, a number of people who have helped me out with some children.
Okay.
They have helped out. When I've requested them, they have helped out, maybe giving them extra time. All those things they have helped. Now I think I would look at that as a positive change. At least the attitude of the most important people in our society is changing.
Okay, so but we still have some way to go.
Yes.
So in our society also, I think, ma'am, inclusiveness is necessary.
Absolutely.
As people, as friends. That's why parents hesitate to take children out, or other than centers, they are, I think, at home.
Yeah.
So together we need to
Absolutely,
bring about
I
a
think so,
change.
yeah.
I think. So before we leave, ma'am, you have told us so many important things. I would like to ask you, if you would like to leave a thank you note to News Karnataka, what would that be, ma'am?
Okay. Yeah, I think like I always tell this when I speak on the media. I think you're doing a good job of being a liaison, because I think these programs are a liaison between the parents and the others. So parents are not able to voice all this. Okay, and parents, like for example this program, I might have given you a few tips now. There might be a few parents who didn't know that. Now they are getting it. So this liaison, this mediating job, I think it's a great job that you're doing.
So first time a channel is taking up this topic of special needs.
So one is building awareness, second is giving information, third is also making people accept these people.
Right, I think that's
That is very important, because when you hear something like this on the news or on the media, then people's attitude slowly changes. Oh, it's okay, maybe, so I can, a teacher might change, somebody, a neighbor might change.
Yes,
so then I think that is a remarkable, contribution for me. And I think as a mental health professional, I can't do that, because I'll be catering to people who come to me.
Yes.
And maybe because I'm taking up a lot of training programs, I'll be catering to people whom I meet.
Right.
But you're catering to a large audience.
Right.
So I think that is a remarkable
This is
contribution.
the only channel who has taken up this topic,
Absolutely.
We as parents, like I'm a parent of a special needs boy. So I think this is a wonderful platform where we can get different views from experts, learn a lot of information.
Yes.
So I think that's really wonderful.
And parents, when they hear this, also feel that my son is not different. There are other parents.
Parents sailing the same boat.
So I think
and
that's
they feel little important. Okay, our topic is
Absolutely.
taken up
Absolutely.
by some channel. So thank you, ma'am. Thank you so much. And I believe all the viewers, especially parents, families, would feel empowered by Dr. Rameela Shekhar's words. She's explained us so beautifully and told us the 5 important points how to work with your child. I think the first thing what she said, love your child unconditionally. That comes from every parent. So this message goes out to you all, especially parents. Please do that. Love your child unconditionally. Work with your child. Give time. I think that's what ma'am told us. Give more time. Of course, we know nowadays time is very precious. It's not there. But please do it. You'll find a vast change. And anyway, experts like Dr. Rameela Shekhar are always there to help you to manage your child's behavior. You can get through her personally also. So please parents, take care and stay safe. Till we meet again in another episode, thank you for joining us in Walk the Special Path. Thank you. Thank you, Doctor.